welcome to the Dental Handoff. I'm Dr. Kelly Tanner. Thank you guys so much for being here. Again, I have Dr. Bartusiak. So nice to have you.
My pleasure. Thanks again. Appreciate you.
And this segment is about the patient is the star. So we, Dr. Bartusiak and I, have a course that we deliver on behalf of Young Innovations about how to bring the team together, different communication style. It's a lot of different cool stuff in that course. But so Barry's a dentist. Of course, you guys know I'm a hygienist. And so I'm kind of like interviewing Barry a little bit to understand, because you have an amazingly successful practice. It's not just me saying this. It's kind of like a known thing because you have like the 5-star rating of like everyone in the country. I'm like, what is this?
My mom pushes the buttons a lot.
But this episode is about how the patient is always the star, right? So what I was telling Barry a lot of times that I see is that it's frustrating sometimes as a consultant that's going into a practice is that I'm watching, I'm just listening kind of like you do. And I'm noticing that the clinician is sitting there talking about their plans during the weekend, their family, their this, what they're doing while they have to get off of work, blah, blah, blah. And obviously, yes, we're in the patient's mouth, right? So we are in charge of that conversation for sure. But there comes a time where that becomes too much. It's different if the patient's asking you about it, but then I really feel like we lose the patient there in the essence of them being central to the treatment while they're there, and that they are the center of attention. And you talk about that in our course.
Yes. To put a little twist on it, it's the patient stupid, to steal a line from the Clinton campaign back in 1996. It's the economy stupid, and it's the patient stupid. It's the patient first, the patient second, the patient third, period. I say to our teammates, look, I signed your paycheck at the bottom, your patient's right at the top. That's how it goes. And I would much rather you please our patients, if you're going to pick one, than me. It's more important. You please them, I'm going to be happy.
Yeah.
Somebody asked me the other day about what is the most important KPI, key performance indicator. It is nothing that you're going to see, no number you're going to see on a sheet. It's laughter. Because if there's laughter in your practice, if the patient's laughing, if the front desk is laughing while they're on the phone with somebody, if your teammates are laughing, if I'm laughing, it's all good.
Yeah, it is.
It's all
and that puts everybody at ease too. Think about that anxious patient. It's like, okay, this is not intimidating at all to be here. They're having fun. They're patients. It's a language that it's an unspoken language that everyone is having fun. It's the vibe.
It's the vibe. You're absolutely spot on. So Mrs. Jones comes in, and so she's all nervous, right? And she'll say, doctor, I'm really nervous about this today. And I'll go, oh, me too, Mrs. Jones. And you can just see her. That's exactly what happens. And she goes, oh, doctor. Or I'll say, hey, Mrs. Jones, we're going to give you these special glasses. We give sunglasses to protect their eyes. And don't worry, I'm going to keep my glasses on. And like, and it's a stupid little thing, but it makes them smile, makes them laugh. You can feel the anxiety going out of the room, and it makes them feel focused and appreciated upon.
Yes.
And, little things matter. I mean, little things are the most important. We all get the big things right. It's the details. It's the little things that make the biggest differences.
You're so right. Yeah. When you remember things, and of course, write them down on the chart for the next provider.
Absolutely.
What's appropriate, like the little memory joggers.
Absolutely. Their grandchildren, their children. Those are probably the two most important things. Ask them what they like. My first question to a new patient is not, hey, how is your health, or what teeth are bothering you, whatever. What do you like to do in your spare time? What do you like to do in your spare time? I love to ride horses. Well, tell me about that. Is it English? Is it Western? How many horses do you have? And they will just go on. And you can just feel the anxiety go out. You can feel their energy, and you can feel that bond.
Yeah.
And you can feel that bond just developing and going deeper and deeper.
I'm just remembering the time when, this is a real story.
Yeah.
When I was a baby hygienist and I started practicing, I was straight out of school. I split my time between a perio office. I was their first perio hygienist, and then also general practice, so I could see both. And
Yeah.
I remember saying to the assistant, her name is Melba, and Melba, if you're listening, hi. And she would attest to this. I went to her, I was like, what do you, I was like, I'm running out of things to talk about with the patient. I don't want to sound like a broken record. And I didn't really realize that I wasn't. I was being genuine.
Genuine and gracious.
So I
Right.
was like, but what do I talk about? You know, what's appropriate for me at my age? But I
Right.
was asking these questions, you know, I was 24
Right.
at that time,
Right.
going,
You're a newbie. Right.
what's important for me to say, to not say? She's like, well, here's what you can do. And I think she actually chuckled. She's like, what do you mean? What do you talk to patients about? I'm like, I'm having trouble small talking because I want to keep it about them.
Right.
And then she said, read the paper. Just read the paper, keep up on some news. So
Mhm.
if people, you know, not that you're bringing them down, or keep certain topics out of the operatory.
Right.
They're
Exactly.
in the paper.
Yeah.
But just know a little bit about, because at this time, you know, being 24, no 24-year-old really does that. So
No,
I thought that
that's
was
correct.
a great way to put the patient back at the center of things, to
Absolutely.
understand the relevancy around
Yes.
around the community, around, hey, are you going to the Jazz Fest this weekend?
Exactly.
Or things like that, that I was
Right.
just learning how to be more cultured in
Correct.
that moment.
Right.
And so it's about how you're involving the patient and what you're doing for them. They get to know about you. They become interested in you
Of
as
course.
well.
Absolutely. So, you know, to echo what you just stated, in life, my opinion, remember, opinions are like armpits. Everybody has a couple of them. One usually smells. So here's the story. So if we're chatting with Mrs. Jones, and my opinion is this: you learn how to do things and how not to do things. So if we're chatting with Mrs. Jones and Mrs. Jones has no interest in sports and she doesn't want to talk about college football or the Steelers, why would I go, boy, did you see that play yesterday? Right? Oh my gosh. How about, why did they make that call on third down? Mrs. Jones is going, third.
You lost me.
What?
You lost me.
Right. And if I lost her, then you think she's going to pay attention when I go, Mrs. Jones, you need a crown on what?
That's
She
a really
don't
good point.
care. I'm out
You
of
guys, you
here.
lost the connection.
Thank you. You nailed it again. Yep. Lost the connection. Right.
So,
And then it's so much harder to make that connection again.
yeah.
Right.
So you got to listen to what they do and they don't. Like, read body language, right?
All about it.
Yeah. Read body language and keep them at the center of attention. Dr. B, thank you so much for being on today. Again,
You're a rock star.
Yeah.
You're amazing.
Love you. Thank you for your insight. To all the listeners, go on to Apple Podcasts, 5-star rating, please.
5. I got it right.
5-star rating. Go on over to YouTube, like, subscribe, and share. Be well, my friends. Till next time.
Thank you.